Dr. Bharat Pankhania. He's a senior clinical lecturer at the University of Exeter Medical School. He's joining us from Bath in the UK. Dr. Pankhania, always good to have you with us. Now, it does seem as if the worst visions of what we thought may happen in India is now being realised. What needs to be done to get on top of the disease there?
Yes, thank you. It's very grim figures and sights from India. And what needs to be done is protect the people who have not been infected. And the one way to protect them is to have a lockdown, a serious, extensive lockdown to protect the people who are not infected as yet. The second point that needs to be done is setting up many field hospitals. It is pointless asking people to come to hospitals, whereas it's easier to set up a field hospital and treat them with medications and oxygen. And then the third bit that is required is to have a good, extensive, safe vaccination program to protect the people who are still lucky enough not to get infected.
And Dr. Pankhania, of course, you will have been watching how this pandemic has spread around the world for the past year and a bit. And India kind of escaped in the first wave, or so we thought. Are we close to understanding why this second wave of the virus has been so damaging?
Yes, we often look at these second and first wave, etc. But the empirical stuff is as follows. India, like New Zealand, like Australia, did very well by shutting down. And by shutting down for 68 days, they managed to keep the virus numbers down, case numbers down, and therefore they started to celebrate that they had escaped the initial phase of the pandemic. The mistake they made is, whilst their case numbers were down, they did not plan that this case numbers can go up as soon as we start mixing with people. It's normal, easy, straightforward biology that as soon as you start mixing with people, case numbers will go down. So they should have used that spare time to build up field hospitals, oxygen manufacturing capacity, and immunizations.
And finally then, Dr. Pankhania, I mean, as you're laying out, it does seem as if the Indian healthcare system is way behind the curve on this. Where do we go from here? Is this going to get worse before it starts to get better?
Unfortunately, it will get worse because the seeding of the number of cases to be generated has already happened. So I'm afraid to say for the next 3 to 4 weeks, unless there is a lockdown, case numbers will continue to rise. And we are seeing pictures right now. All of those people are at risk of getting infected because they're not wearing masks properly, they're not social distancing, and they're out and about. Therefore, India needs to get a grip on these things and have a lockdown immediately.
Absolutely. Okay, Dr. Bharat Pankhania, always good to get your advice. Let's hope the Indian government's listening. Thanks for being with us.
Thank you.